I think, as most of you know, the field of transplantation has been a very exciting area of science, medicine, and surgery over the past 7 or 8 decades, when the first successful organ transplants were made. Hello, my name is Matthew Griffin. I'm a consultant nephrologist and specialist in transplant medicine. I had the great pleasure to train and work in Mayo Clinic, Rochester, in the Division of Nephrology and Hypertension, and in the Transplant Center at Mayo Clinic for quite a few years. And now I practice in the University of Galway on the western coast of Ireland. But I've maintained my strong links with Mayo Clinic, and particularly my passion for the field of transplantation. So it was my pleasure to author an editorial for the 100-year celebration of Mayo Clinic Proceedings, addressing the topic of transplantation. And this editorial, entitled Mayo Clinic Proceedings and Progress in Solid Organ Transplantation, will be appearing in the April issue of the current volume of Mayo Clinic Proceedings. One overarching characteristic of transplantation has been its success in overcoming formidable barriers to help people with life-threatening and life-altering organ failure to achieve new levels of health and restore organ function where no other treatment has been able to do so. And we now are able to apply organ transplant successes to people with kidney failure, heart failure, liver failure, lung failure, intestinal failure, and even multi-organ failure, with quite consistent success rates. Now, as I took on this task of writing the editorial, it really made me stop and think about how research and innovation has driven the field of transplantation, and how it continues to achieve greater levels of success, and perhaps more importantly, find benefits and clinical niches for a wider range of patients, or be able to offer organ transplantation to people who might have previously been considered ineligible, or people in communities or parts of the world where transplantation had not previously been applied. So it was my pleasure to take a journey back through the volumes of Mayo Clinic Proceedings, both the very recent ones, where I've been involved in as an associate editor in evaluating some papers, and then from prior decades over the past 40, 50 years, to reflect on research and innovation that has been published in the pages of Mayo Clinic Proceedings, and how it has contributed to the growing success of organ transplantation over the decades. And a few of the things that stood out to me in reviewing the body of work that's been published in our journal over this period of time are how multidisciplinarity is so critical to successful research that's aimed at improving clinical practice in an area such as transplantation. And some of the studies that I've picked out to highlight in the editorial are beautiful examples of how health professionals and people from very different professional specialties can come together to perform a research study or design a clinical innovation practice that can methodically and scientifically generate the evidence base for a new step forward in the success of transplantation, or the outcomes for people receiving organ transplants, or the application of transplant techniques and transplant practice to an area where it hasn't been applied before. So I think this particular area of practice stands out as a highlight in my own personal journey in patient care and professional fulfillment, but also in the journey of Mayo Clinic Proceedings to make meaningful contributions to clinical knowledge, scientific knowledge, and clinical practice innovation that has helped to drive success and ultimately improve quality of life and quantity of life for people with organ failures of different types. So if this is a topic that you find interesting, or if you would like to read a little more about transplant-related research and reports that have been published in Mayo Clinic Proceedings, I invite you to read my editorial in the April issue, and look forward and look out for new studies in this area that will continue to be published in Mayo Clinic Proceedings and in its sister journals in the years to come. So thank you for listening, and I would welcome contact from any of you if you're interested in this topic. You'll find my email address along with the editorial. Thank you very much.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.